Lyme disease is a really terrible term to describe what happens in people infected with Lyme-related infections. It seems to imply and foster the belief that Lyme is a typical infectious disease that can be eliminated in a manner similar to that of other infectious diseases, such as strep throat or pneumonia. But Lyme disease is about multiple chronic intracellular, inside the cell, infections that have slow and progressive harmful effects upon the body's functional processes, which in turn create new problems. Dr. Burrascano was the first to understand that Lyme disease is a chronic condition that requires long-term treatment. He initially defined Lyme disease as infection with Borrelia, Babesia, Bartonella, and Ehrlichia organisms. Over time, he expanded the definition and now describes it as a complex of chronic infections that cause immune system deregulation and gastrointestinal and neuroendocrine, nervous system and hormonal, dysfunction, among other downstream ramifications that occur in the body as a result of chronic infections. All of these problems affect the body's capacity to function and interfere with its homeostasis, or balance. Today, when people say that they have Lyme disease, others tend to think that they are just referring to a single problem in the body, a Borrelia infection. But Lyme disease is a complex of infections that affect the functioning of people's bodies differently and profoundly, depending on their strengths and weaknesses. For instance, I have found that Lyme most affects patients in areas where they are weak, or those areas of the body that have already been compromised from things like life stressors, injuries, genetic problems, and other factors. The infections have a lesser effect upon the areas of the body that are strong, or which are functioning at a higher capacity. I always tell my patients to never compare themselves to anyone else who they know with Lyme disease, because the disease affects everyone differently. I have patients that become discouraged when they hear about others with Lyme who have been on antibiotics for years and who are still not better. I remind them that their prognosis is completely different from anyone else's, and what doesn't work for one person may work for another, and vice versa. Treatment needs to be individualized and tailored to each patient.